With more than 40 years of medical practice, I have examined numerous knee joints. These were knees that danced at weddings, held children and grandchildren, and walked countless kilometers throughout life. There were also those that let their owners down at the most inconvenient moments. My name is Artiped. I am 97 years old, and I understand how precious each step is. I have witnessed how people lose the joy of movement when stiffness in the joints slowly robs them of their freedom. But I have also seen miraculous recoveries, even in cases that seemed hopeless. Today, I will tell you about the one product capable of working wonders for knee joints, which many doctors do not believe in. This is not a marketing gimmick or a fairy tale, but something I have used myself and that has helped many of my patients. And here is what is important. At the end of this story, I will share the main secret that almost no one mentions, neither in the news, nor in pharmacies, nor even in doctors' offices. A secret that can change your life, restore the lightness of movement, and possibly eliminate the need for surgery. Why is this so important in older age? Because joints are our support and independence. The loss of mobility is not just pain, it is the loss of the ability to walk, meet friends, visit children, and it is a step toward isolation and a reduction in one's living space. Now, the question is, do you allow yourself to enjoy life as you did in your youth? To rise easily and without pain? To descend stairs without holding onto the railing? To dance at celebrations without fear of your knee giving out? Today, you will learn how to regain that sense of freedom. And right now, I will discuss something that many underestimate. In youth, joints work smoothly, like a well-oiled mechanism. We do not even notice that complex systems are involved in every movement. Bones, cartilage, ligaments, muscles. Everything is arranged like in an expensive watch. But over the years, this mechanism begins to falter. And do you know what is most insidious? The destruction of cartilage in the knees begins long before the first pain appears. Many of my patients have told me, "Doctor, my knee suddenly started to hurt," while the scans showed that the destruction had been occurring for 10 years. The body simply endured until it reached a critical point. Why does this happen? The secret is that cartilage does not have its own blood vessels. It is nourished by synovial fluid, which delivers nutrients, just as a river brings water to a field. With age, this river begins to dry up. The synovial fluid thickens, and metabolism slows down. Then the cartilage starts to thin. In youth, the body produces enough components for cartilage tissue restoration. But after the age of 50 to 60, production slows down, and after 70, it nearly stops for most people. As a result, every movement becomes a small shock to the joints. I remember my patient, Galina Ivanovna. She was 74 years old and came to me for a consultation because she could no longer walk to the store without stopping. She said, "Doctor, I used to walk with my grandchildren for 3 hours, but now even 300 meters is a challenge." We conducted an examination, and it turned out that the cartilage in her knees had practically worn away, and the joint space had narrowed. It seemed that it was already too late to make any changes, but I knew there was still a chance. We began treatment using a special remedy, which I will describe a bit later. And after 2 months, Galina Ivanovna was already greeting me at the office door without a cane. This is the key. Recovery is possible, even at an older age, if you know what exactly to provide for the joints. But it is important not only to nourish the cartilage. The joint is a living system. If there is constant stress in the body, if the blood vessels are in poor condition, if we do not move, the cartilage will not receive nourishment, even if we consume beneficial substances in large quantities. Therefore, the first thing I always tell my patients is to stop hoping for a miracle pill and start viewing the joint as part of your entire life. Calmness, proper physical activity, an adequate amount of water, and normal sleep are all as important as what we eat. Now I will move on to my first piece of advice. This is a specific product that I have recommended to many people, and which can rejuvenate your cartilage like a dry sponge soaking up water. I call it fuel for the joints. This is a product that restores cartilage not in theory, but in practice. I have observed its effects dozens of times in people aged from 60 to 90 years. We are talking about gelatin, but not the kind sold in packets for desserts. Rather natural collagen, a protein that is the main building material for your cartilage, ligaments, and tendons. Why this one? Cartilage is 70% made up of collagen fibers, which act like steel reinforcement in concrete. Without them, the structure simply crumbles. As we age, our body stops producing collagen in sufficient quantities, and then the cartilage becomes soft, brittle, and begins to wear away. Collagen from food is like a spare batch of bricks for an old house. It enters the bloodstream and then the joints, where the body uses it to repair damaged areas. The most interesting thing I saw in recent studies, in people over 70 years old who took hydrolyzed collagen daily, the thickness of the joint cartilage began to increase after just 4 weeks. This is not a miracle. This is biology. The tissue simply received the material it had been chronically lacking. From my practice, there was a patient, Nikolai Petrovich, 82 years old. He loved to fish but stopped because his knees hurt, and even the walk to the river became a torment. I advised him to add 10 grams of hydrolyzed collagen to his porridge or warm water every morning. He was skeptical, saying, "Doctor, what can some powder do?" A month later, he came back and said, "I went fishing again." The pain did not completely go away, but I was able to sit on a chair by the water for 4 hours. After 3 months, he was already going to his dacha without any problems. Yes, we have added gymnastics and dietary control, but it is collagen that played a crucial role in the recovery process. The best way to take hydrolyzed collagen is that it is easier for the body to absorb. To maintain joint health, 10 grams per day is sufficient. If there are already significant issues, it is advisable to increase the dosage to 15 grams. It should be taken in the morning with warm liquid or as part of breakfast. Do not forget about vitamin C, for example, in the form of an orange, rosehip, or kiwi, as it promotes better absorption of collagen in the tissues. Try this for at least a week, and you will notice changes. Of course, pain will not disappear in one day, but you will feel that your joints are becoming more mobile, and morning stiffness will diminish. I urge you, do not delay. Each day without recovery brings you closer to a cane or surgery. In the second recommendation, I will talk about something that helps not only the joints, but also literally slows down brain aging. The second recommendation may surprise you. We just discussed collagen, which restores cartilage, and now I will tell you about a product that affects not only the joints, but also the brain, heart, skin, and even mood. We are talking about fatty fish, such as salmon, mackerel, sardines, and herring. Here, it is not the proteins that matter, but the omega-3 fatty acids. Why are omega-3 fatty acids so important after the age of 50 to 60? Imagine that your joints are like door hinges. Over time, they accumulate rust, which means micro-inflammation. Omega-3 is the oil that not only lubricates the hinges, but also cleans them of rust. Scientists have noticed that people with sufficient levels of omega-3 in their blood experience less osteoarthritis, inflammation, and cognitive impairments. These fatty acids reduce inflammatory processes in the body at the cellular level. It is important to note that omega-3 fatty acids are beneficial not only for the joints. They nourish brain cells, improving memory and concentration. They reduce the risk of heart attacks and strokes, increase skin elasticity, and help with dryness of the eyes and skin. Here is a story from my practice. One of my patients, Valentina Ivanovna, 74 years old, came to me with complaints of knee pain and forgetfulness. She said, "I used to easily remember the names of all my neighbors, but now I sometimes forget why I went to the store." We added 3 servings of fatty fish to her diet each week and omega-3 capsules every day. After 2 months, she admitted, "Doctor, I have started waking up with a clear head, and my knees hurt less, especially in the morning." How should omega-3 be taken? From food, 2 to 3 times a week, fatty sea fish, preferably baked or steamed. From supplements, 1,000 to 2,000 milligrams per day, with a content of EPA plus DHA, and not just fish oil, is best taken during meals that contain a little fat. Doctor's comments. In my experience, people who consistently consume omega-3 for many years not only complain less about their joints, but also look younger than their peers. Their skin is softer, their gaze is clear, and their movements are more confident. But there is one more aspect that many underestimate. It can literally destroy joints and overall health if overlooked. In the third piece of advice, I will talk about an important habit that can dramatically impact your health in old age. This element is not a capsule or an unpopular supplement, but simply water. Yes, plain water. Now you will understand why it has the power to both restore and destroy your joints. Why is water so essential for your cartilage? Cartilage is not just dry bone. It is a whole system of shock absorbers, made up of 80% water. When the body lacks fluid, cartilage becomes stiff and loses its elasticity, leading to faster wear and tear. I often discuss this in my consultations. You can take collagen and omega-3, but if the body is deficient in fluid, these substances will not be able to reach the cartilage in the necessary form. What happens when you neglect water? Joints start to creak and hurt even with light loads. The risk of inflammatory processes increases. Blood thickens, making it harder for nutrients to reach the joints and muscles. Fatigue, drowsiness, and headaches increase. This slowly undermines the body, especially in elderly people, who often have a diminished sense of thirst. Many believe that if they do not feel thirsty, they do not need to drink. This is a trap. Dehydration can already be present in full force, but you may not feel it. An example from practice. I had a patient, Nikolai Petrovich, 81 years old. He complained of constant creaking in his knees and severe morning stiffness. He was taking supplements, but there was almost no improvement. I asked him how much water he drank daily. He replied, "Well, tea, soup, rarely water, only in hot weather." We started small. 2 glasses of plain water in the morning and 1 before lunch. After 3 weeks, he said, "Doctor, now I can get up in the morning without needing to walk around for 5 minutes. How much and how should one drink water after 60 years?" It is necessary to aim for 1 to 2 liters of plain water a day, not counting soups and tea. Drink in small sips, but regularly. Be sure to drink a glass in the morning to activate the joints and metabolism. In cold weather, you can drink warm water or herbal teas without sugar. It is important, in cases of serious problems with the kidneys or heart, to coordinate the amount of water with a doctor. And now we have come to the 3 key steps that are interconnected. Collagen restores the structure of cartilage. Omega-3 reduces inflammation and nourishes the joints. Water helps these substances perform their function. And now, the most important thing I promised to talk about at the end. There is a small detail that can significantly enhance the effect of all 3 recommendations. Few people know about it, but it can make your knees mobile and pain-free even at 80 years old. We have discussed 3 simple yet powerful steps that help restore and maintain knee health. Collagen is the building material for cartilage. Omega-3 is a natural anti-inflammatory agent for the joints. Water is the main conduit for nutrients in cartilage and ligaments. If you combine them, the effect will be much stronger than from each one separately. Just as bricks and cement are needed for building a house, collagen, omega-3, and water are necessary for joint health to bring everything together. Without one of these components, the structure will be incomplete. Small habits can significantly improve the outcome. A light morning warm-up for the knees, a warm shower, or applying a heating pad to the joints before a walk can make a difference. Daily walks in the fresh air for at least 20 to 30 minutes, limiting sugar and processed foods, and practicing calm breathing or meditation for 50 minutes each day help reduce stress, which directly affects inflammatory processes. An additional tip from a doctor is the method with a joint mask. This is a simple exercise that I recommend to all my patients. Sit on a chair with your feet on the floor. Slowly lift your heels while keeping your toes on the ground, then lower them. Next, lift your toes while keeping your heels on the floor. Repeat this movement 20 to 30 times. This improves the circulation of synovial fluid, which nourishes and lubricates the joints. The exercise takes only 2 minutes, and the effect is noticeable within just a few days. The most important thing I want to emphasize is that many, especially after the age of 70, believe that pain and crunching in the knees are inevitable. However, joints can recover at any age if they are regularly provided with what they need. Consistency is key. Remembering once a week will not help. What matters is persistence. I have seen 90-year-old patients who, after 3 months of regular practice, began walking in the park without a cane, and I have seen those who postponed changes and lost the ability to maintain mobility. Take care of yourself. Your time is valuable at any age. Remember, even small steps can significantly change your life for the better. Write in the comments which of these tips suits you best. And please share this information with your loved ones and friends so they can also receive such support.